So it is my great pleasure to introduce our next session, which is called Fighting Fatigue Together, from Concern to Action, launching a national collaborative Fighting Fatigue Together campaign in Slovakia. And it is, those who know me, you know that I'm very much involved in the Fighting Fatigue Together campaign. And we really try to bring it to life in different countries, and we have excellent working group now being active in many countries, and you can learn more about the campaign during the workshop that will be organized in the afternoon. And but this is even a bit more special because I come from Slovakia, and the healthcare there is facing many challenges for the time being. And when we got in touch together with Martina and Zuzka, it was just amazing to see the quality of work, their enthusiasm and excellent organization they put in bringing the fatigue campaign to life in Slovakia. So I'm really proud to welcome them here and to, well, that they have the possibility to show you how they managed to make it, work, to start officially in Slovakia. So thank you very much for joining us today.
Him? Of all people? I wouldn't have done that. Exactly.
Ladies and gentlemen, it's my pleasure that I can stay here. Dear organizers, first I would like to thank you for your kind invitation and for the opportunity to share with you our first steps on developing a national fighting fatigue campaign in Slovakia. And let me start briefly with some facts and figures that motivated us to develop this campaign. So as you can see, Slovakia is among, I'm sorry, I don't know. Okay, perfect. So as you can see, Slovakia is among the countries currently which has significantly lower numbers of doctors as well as lower numbers of nurses in comparison to EU averages. Furthermore, current estimations for near future are even worse, unfortunately. So as we can see, it is expected that in 2030, the number of doctors in Slovakia will increase, and similarly also number of nurses will decrease. And if we look at the neutral scenario, this neutral scenario is furthermore linked also to the increased proportion of older people over 60 plus, where we have increased number of people per one doctor and also increased number of people per one nurse. So these data for sure warn us that real workload of our healthcare workers will increase, and accessibility of health services will decrease in near future in Slovakia. One of the latest WHO and the very first of this kind of survey oriented on mental health of healthcare workers, which is based on the data collected during the last and the beginning of this year, show us that also Slovak doctors and Slovak nurses reported quite higher prevalence of probable major depressive disorder and passive suicidal thoughts. So these very fresh data again warn us. We also check some available data from our national surveys during the last 10 years from selected studies, and based on these national surveys, we can also see that the situation is not good if we look at mental health status of our healthcare professionals, especially from perspective of emotional exhaustion, which seems to be highly prevalent among also other different healthcare workers, not only medical doctors, but also, for example, medical rescue staff, but also some specific nurses in some specific professions. The same survey, which I mentioned from the WHO, also bring first mapping about the risk factors and protective factors, which seem to be play the most important role for Slovak healthcare doctors and nurses. Like in relation to risk factors, we can see the problem with extended working hours or problem with frequent rotating shifts. And furthermore, the same research, the same survey show us that Slovak doctors and nurses reported more frequently intention to leave profession than other EU27 countries. Thus, these are just some facts and figures which supported us, and we realized that our healthcare workers shouldn't be heroes who burn out silently, and we need to start addressing it somehow. And how did we start? Thanks to the Fighting Fatigue campaign, we decided to adopt this campaign. And it is my pleasure now to give the floor to our leader of our campaign, Martina, and she will share you our first steps.
Thank you. I am very happy that I am here, and I present some 6 steps from our campaign. Before I explain how we started our campaign, let me give you context about the Slovak healthcare systems. I will be very critical because the Slovak healthcare system lacks vision, is not transforming, and is not sufficiently critical of itself. We have no strategy of digitalization, research, or innovation. And one of the main reasons is that Ministry of Healthcare has no long-term strategy nor vision, because we have every year new Minister of Healthcare. It's terrible. So we have also any other problems. Governance of healthcare is focused on consequences, not causes. We have no nurses. In this time, 14,000 nurses is in absence in our systems. And now our political situation, absence of transparency, corruption, worsen, and overall bad situation. So I can say that we can present ourselves as great, but the reality completely different and contradictory, and the health workers are afraid to say what's going on. Therefore, our NGO, Práve preto, in English, that's why, was founded in February this year. And we started with project for NGOs pro bono, probably or mainly healthcare project for some organization, autism, oncology patient, etc. And we starting project in transparency and advocacy in healthcare. And my friendship and communication with Mirka lead to corporate or NGO discussion and decision. It was for individuals saying enough is enough, and we start preparation of the campaign. So from March to September this year, we prepare core team. We have many meetings and discussion, and we absolve formal steps with EUPSF. And first milestone was in June. We prepare first virtual meeting with our partners and our networkers, and finish goals and a plan for next month and next year. Second milestone was in August this year. We prepare complete on-site workshop in Spa Sliač when we finalized 3 work packages: education, research, and communication. And we completely prepared timeline, and parallelly we still build our network, and we prepare a website. So the campaign is organized into 3 work package. Every work package have a leader. It is education, it is visibility, and also research. The education group focus on training and capacity building. The visibility group handles communication and public awareness and engagement. And the research group prepare some specification for data obtaining and questionnaire, and some topics for research. And we have some meetings when we mix of results or outcomes from these groups, and the results come into the healthcare systems. So our campaign is called Exhausted, Together Against Fatigue, with the tagline, because even healthcare workers are human. And our procedure or our process lead to 4 main aims or main objectives. Let's talk about fatigue. We are in process a huge communication campaign in media and social networks. Second aim is safety is not just about protocols. Fatigue in a healthcare system is real, human, and dangerous under discussed, because our healthcare workers have a real fear. Talk about fatigue, talk about medical errors, diagnostic errors, etc. So we want to break silence, normalize the conversation, and build trust across professions, because pretending we are invictible helps no one. Free educate before fatigue becomes a system failure. It's important because the healthcare workers make mistakes, and we are using European and Slovak data to shift the culture of fear and culture of mistakes to culture of safety. And 4, build a support system. This is very important aim. We cooperate with the League for Mental Health and create a system of support and resilience for healthcare professionals. So this is our timeline only to end of year 2026. We are now in phase 1 and 2. We start campaign in September this year, and now we prepare questionnaire for data obtaining. And in January, we started phase 3 education in hospital with cooperation with our academic partners, League for Mental Health, and private company partners. And we now we are also in communication with insurance company, because it is very important steps for supporting our activity. So some picture from the start. We officially launched the campaign on September. We have press conference. Our message was clear and direct. If you are exhausted and tired, say it out loud. And we have many medial interest, which will be very significant. You can see many pictures from Slovak media, and I think it is very important, because we must change the thinking in healthcare. So we have also not medial communication and media visibility, but we have been deeply engaged in expert discussion. We attend some professional conferences, and we participated in national and international conferences. For example, in these months, we attend a conference for anesthesiology nurses, a huge national conference, healthcare management in Slovakia. So we also cooperate with all Slovak patient organization, and we will attend their conference. And we also attended the conference or congress for occupational medicine, because the burnout and something mental illness are important for occupational medicine also. So we have many individual discussion with experts from different areas: sleep expert, nutrition expert, etc. So it's also very important for us. The current situation about the network. So let me show our current situation. We built our partnerships with universities. The main partner is Department of Social and Behavioral Medicine in University Pavel Jozef Šafarik in Košice. And we have also cooperation with University in Prešov, Catholic University in Ružomberok, Comenius University in Bratislava, and we have also communication with others, NGOs, professional association. The big partners is Slovak Chambers of Nurses and Midwiferys. Others, for example, young doctors, it's very, very important, because we identified that the burnout is in a group in a young nurses and young doctors 2 to 5 years into go to practice. And we have media partners, Ozdravme SK, Grape, PR, Medicina SK, and many other partners. So looking ahead, we have clear next steps. In next phase 2, we need to prepare a good quality questionnaire for healthcare workers about fatigue, but we still need data. We have no data about medical and diagnostic errors, because we have a legislative which prefer identification in a hospital, and these data are not objectives. And we also prepare KPIs for monitoring of medical and diagnostic errors. And in education, now we prepare the training program for education with cooperation with League for Mental Health and university partners, but it's soon to speak about this now, maybe next year. And what we need? So we need support from us, from people as but we need a real commitment, not just nice word. We hear nice words every day. We need support from leadership, organization, everything. We need also cooperation, because this problem is too big for any small group, as práve preto. We need cooperation with many disciplines and across the border. We need information sharing, because let's learn from what works instead of repeat mistakes, data, experiences, lesson learned. And we also need best practice sharing, what works, what doesn't, and why. And we also need international partnership, because fatigue knows no borders. And it's all for this time. Thank you so much for your attention.